Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, October 19th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, good afternoon and thank you, Brad. Today we have clear advice from Ontario's Chief Medical Officer of Health about Halloween for places like Toronto, Peel, York and Ottawa. We asked the Ontario government and health officials there for clear and simple advice on Halloween, and they have provided that advice. Things will be different this year. Just like many other holidays and special occasions, that's the sad reality of this pandemic. I know families will find ways to celebrate Halloween in their own homes and with their own kids. For areas such as the City of Toronto, which is in modified Stage 2, residents are advised to follow provincial public health advice and not to trick-or-treat door-to-door this year. Celebrate at home with each other, dress up with the kids, and double the planned candy handout for next year. Now, I know this is profoundly disappointing for many kids and families, especially for the kids. As a father and as a grandfather, I know how much Halloween means to kids and to families. I remember how much it meant to me. So I'm disappointed for them that trick-or-treating as we know it won't be possible this year, like a lot of other simple pleasures we've all enjoyed in other years and will again soon. I usually take my grandchildren out at trick-or-treating and was looking forward to doing that again this year. I know my daughter Susan, a medical doctor herself, is planning fun activities for the kids at home, including a candy scavenger hunt, and that is something she told me she was going to do 10 days ago before this provincial advice came to us. So I encourage parents to be creative and, as I said, for people to be extra generous next Halloween, but I think we can make it fun for kids, notwithstanding the advice that is rendered from the province today. The Toronto Board of Health met today and unanimously approved a motion to develop and publish a COVID Response Equity Action Plan as part of the ongoing response to the COVID-19 pandemic. This plan will bring together in one place all existing work underway by the City so that we can better demonstrate the work that the City is doing and ensure that we are held accountable by the communities that we serve. The Board of Health also endorsed recommendations from Dr. de Villa to increase access to testing in high-transmission neighbourhoods, to make public health information more accessible and available in more languages, to increase infection prevention supports for community agencies working on the front lines, and the Board also called on the Government of Ontario to implement a stay on residential evictions and ensure paid sick leave for all workers. Earlier this year, Toronto Public Health became one of the first public health units to proactively collect and share disaggregated data on COVID-19, race, income, household status, and other socioeconomic indicators. The data revealed that the disproportionate impact of the pandemic on marginalized communities, such that 82% of people who contracted COVID-19 in Toronto identify with a racialized group, although only 52% of the city identifies as non-white. Half the people who've contracted COVID-19 live in low-income households compared to 30% of the general population, which does. In response to this data, Toronto has implemented a series of measures, including, for example, working with the federal government to open Canada's first voluntary isolation facility for people who can't safely self-isolate at home, usually because of too many people living in very small accommodations. And as well, we successfully advocated for the province to implement mobile testing options in high-impact communities. Finally today, I convened the weekly meeting with the GTHA, Greater Toronto and Hamilton area mayors and chairs, the 11 biggest municipalities, and separately, I hosted a summit with the hospitality industry, including hotels, restaurants, and the performing arts sector, local business improvement areas, and federal officials. I am committed to making sure that our city is doing everything that it can as a municipal government to help restaurants and hotels and the performing arts to get through this pandemic. The summit was a very constructive get-together, with financial liquidity being an urgent issue shared by all of the sectors represented: hotels, restaurants, performing arts organizations, and others. Many of the different sectors and many of the participants had positive suggestions about how assistance programs currently put in place by the federal and provincial governments could and should be modified to take account of differing circumstances that they have And there was broad agreement that coming out of the 28-day pause, we have to strive for greater consistency between and among various sectors, one to the other. I reported these comments to the mayors and chairs, and they added to this list a concern about reports of financial institutions recalling loans and lines of credit extended to smaller businesses which are now struggling. As well, the Hospitality and Performing Arts Group once again raised the insurance issue, with many of them reporting that liability insurance policies were either being cancelled or were facing huge premium increases, often more than doubling, when these businesses, their clients, the insurance company's clients, are hurting badly. I repeat what I said last week. Well, I realize that banks and landlords and insurance companies, and for that matter, food delivery companies, are also in business. Their own businesses will be way worse off if they take unreasonable, inadvisable measures now and end up putting their own customers out of business. They won't have any customers left. Now, I know that people are getting tired of the pandemic. They're getting tired of the restrictions. They're getting tired of life being so fundamentally different than it used to be, and that we all hope it can be again. But as we see in the daily numbers from our public health officials, and you'll hear more from Dr. Davila in a moment, COVID-19 is still here in our city, and it still poses a threat to our residents, especially to those who are more senior. We are doing everything we can based on expert advice so that we can keep people healthy and alive, protect the healthcare system, keep schools and childcare open, and protect our elderly citizens. We are following the advice of the experts, and we are taking measures to protect people who are more vulnerable so that we can avoid something much worse and so that we can have a strong and complete recovery. And so I urge you to hang in there, even though it gets very frustrating and it gets very trying on patients, because we are trying to do the right things. The vast majority are doing so, and I think over time these things will have the desired effect. And on that note, I will ask Dr. Davila if she will offer her report for the day.
So good afternoon, everyone, and thank you, Mayor Tory. Today, I am reporting 268 new COVID-19 cases in Toronto. This brings our total case count since the pandemic started to 24,624. As the Mayor noted, earlier today, Ontario's Chief Medical Officer of Health called for a different approach to Halloween for places like Toronto, given the circumstances in which we find ourselves. I will return to this shortly. But first, I want to share that my team has resumed collection of individual-level socio-demographic data. The collection of this data resumed October 9th, after it was paused on October the 2nd to address the surge of cases that needed to be contacted for isolation. Also today, we launched 2 additional maps on our dashboard, a map by neighborhood of COVID-19 % positivity and a map of testing rates. You will be able to find these maps on our COVID-19 Status of Cases in Toronto webpage. The inclusion of neighborhood data comes with the important qualifier that the % positivity for a neighborhood should not be used in isolation. It is more meaningful when considered in combination with other indicators of pandemic activity, including number of cases, case rates, and testing rates. We also know that the virus is spreading to different extents in different parts of the city. Where COVID-19 is hitting hardest, tailored, targeted action is needed, which is why the Toronto Board of Health today unanimously approved a City of Toronto Health Equity Action Plan. As you've heard also, today, the Board of Health supported my recommendations to increase access to testing in high-transmission neighborhoods, to make public health information more accessible in more languages, to increase infection prevention and control supports for community agencies, and called on the province to implement a stay on residential evictions and ensure paid sick leave for all workers. These are things that matter in so many respects. I think we can all agree that a city fuller with healthy people, is better for us than a city dragged down by the costs of preventable illness. Now, returning to the announcement today by Ontario's Chief Medical Officer of Health, who is recommending against door-to-door trick-or-treating in Toronto and other parts of the GTA where high COVID-19 rates are especially concerning. While trick-or-treating is often outdoors, it's also a situation that brings too many people into close contact, and one where it's far too possible to mix closely with others and let your guard down. This is consistent with the broader advice meant to strengthen our ability to limit the spread of COVID-19 by limiting contact with people you don't live with. While I know so many of us look forward each year to Halloween festivities, I am sorry that you are being asked to do this holiday differently too. I am glad that there is a great deal of unity around this question in the GTA and at the provincial level. Unity is important to the success of tough choices. So I am asking you to plan a low-contact Halloween that assures distancing, supports mask wearing, and concentrates on Halloween with the people you live with. This is a moment to send an important message by adapting Halloween to reflect the constant risk of COVID-19. The virus is a fact of life, in every part of life, in all our lives, and we forget that at our peril. While it's disappointing to change Halloween, there is information I want to share today that I expect will demonstrate that the recommended approach to Halloween is the safest, smartest, and regrettably, right for our current times. My team's analysis of local data is painting a picture of resurgence this fall, one that confirms some fears, dispels others, and in all instances, tells us we have to remain on guard, however wearying or tedious or even normal the pandemic may feel. Our data tells us that at present, our daily case counts are very high. More concerning, approximately 35% of all of our COVID-19 cases have been reported in the 10 weeks since August the 1st. And with increased case counts, we are starting to see increases in outbreaks. In September, we saw incidents linked to bars, indoor dining, and group fitness settings. Recently, we're seeing a growing number of outbreaks in long-term care. One thing that is most common to these outbreaks is that they occur amongst those who are together indoors, perhaps finding it difficult to physically distance and not wearing masks. We're also seeing that in terms of age, related to the resurgence, the proportion of cases in people 40 and under has grown considerably to 50% in the last month, compared with 35% in the initial wave. We also have some information about the role of schools as a factor in this fall's resurgence. Based on our data so far, the resurgence does not appear to be primarily driven by the reopening of schools. In fact, rising infections began before schools were reopened in mid-September. The increase of cases in adults preceded that in children. The increase in children appears to be following a similar curve to that in adults, but lags a little behind. The percentage of cases that are under 18 years of age does not appear to be markedly increasing. This will be constantly reassessed as the school year continues, but so far it has been hovering around a 10% increase from the preschool opening baseline. Finally, the number of outbreaks in schools so far has been small, and they usually involve less than 5 students and staff. And recall that there are about 1,200 schools in Toronto, and as of today, 11 active outbreaks. If we must have any outbreaks, I'd prefer numbers like this, which suggest relatively good infection prevention and control measures. So the data are clear. Infection rates at present are worryingly high. The return to school does not appear to be a significant factor in the resurgence that is happening right now. There is a basis to believe the return to school is being effectively managed in terms of infection prevention and control. And finally, recall that approximately 35% of all cases have been reported in the 10 weeks since August the 1st. Our individual choices are adding up to a high price paid since then. And we know that there is still a long road ahead. To travel it with the least risk, I urge you again to limit as much as possible your contact with people you don't live with. Keep your guard up and be consistent in protecting yourself. Keep a good distance of at least 6 feet from people you don't live with when you're out. Wear your mask whenever you can, and wash your hands frequently. One of the biggest risks is that you could be infected with COVID-19 and not know it. And not knowing it infects someone else who is not as lucky and suffers greatly as a result. Many of us are living through COVID-19 greatly stressed, hugely frustrated, but overall, mostly just inconvenienced by the circumstances around us and the sacrifices we have to make. It's hard to equate the loss of a hockey season or a traditional Thanksgiving or Halloween with the loss of a job, the loss of a livelihood, the loss of lung capacity, or the loss of a loved one. Please, don't give up on protecting yourself and, by extension, everybody else. The risk remains, but our ability to limit it is as strong as ever. We must stay strong and resolved, and together, I know we can. With that, I'll now hand it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. The City of Toronto has continued to deliver both essential and critical services without interruption since the outset of the COVID-19 pandemic. This holds true for the 10 long-term care homes that are operated directly by the City of Toronto. Our Senior Services and Long-Term Care Division have been leaders throughout the pandemic by proactively implementing every possible measure to limit the spread of COVID-19 in our city-run long-term care homes. There are more than 2,600 residents and approximately 3,000 staff members across the 10 city-run homes. There are approximately 80 long-term care, nursing, and retirement homes in Toronto, although the City of Toronto only operates 10 of these. At this time, our Senior Services and Long-Term Care Division is managing an outbreak at Fudger House, located on Sherbourne Street, which is home to 250 residents. There are 22 confirmed resident cases of COVID-19, a combination of both symptomatic and asymptomatic individuals, and 5 confirmed staff cases, originating in one specific area of the home. As always, any staff members who test positive for COVID-19 self-isolate at home, and are not in the workplace. To mitigate further spread, Fudger House has been working closely with Toronto Public Health, the Toronto Central Local Health Integration Network, local hospital partners, and has medical experts on site to care for all residents. The following outbreak management practices are in place at all 10 city-run homes. Enhanced active screening processes are in place for anyone entering the building. All staff members and residents are being tested and retested as necessary. The cohorting of staff members, as well as isolation of residents, as necessary. General visitors are no longer permitted, and both indoor and outdoor visits have stopped. As per ministry guidelines, visiting is restricted to essential visitors only, as comfort to those who are close to end of life and to essential caregivers who provide essential support for a resident, such as feeding and regular assistance with activities of daily living. Essential end-of-life and palliative care visits for residents, including those with COVID-19, have been made possible throughout the pandemic, even if a home is in outbreak. Frontline staff are receiving additional support with personal protective equipment and with infection prevention and control education and audits. Enhanced cleaning and disinfection continues throughout the city's homes, and continued proactive communication with both residents and their families. Overall, continuous monitoring and communication with Toronto Public Health will remain an ongoing priority. We have the General Manager of Senior Services and Long-Term Care, Paul Raftis, on the line to respond to your specific questions that you may have this afternoon. I encourage everyone to continue to follow the advice of Toronto Public Health and to maintain compliance with the important public health measures as we all do what we can to minimize the resurgence of COVID-19 in our city. As always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
We have a number of staff on the line to answer any specific questions reporters may have, including the Toronto Police Service, Municipal Licensing and Standards, Senior Services and Long-Term Care, as the Chief just indicated, Shelter Support and Housing, Transportation, and Parks, Forestry and Recreation. First question is to Lucas Meyer from News Talk 1010. Lucas, go ahead, please.
Thank you, Brad. Hi, everyone. Okay, well, I guess I'll start with the Halloween questions then. Dr. Davila, I know this was ultimately up to the province, but Dr. Williams did say that this really has the sign-off of all the local medical officers. And, the rationale being, we really can't trust that you might have some people following, certain creative solutions and others might not. Theresa Tam said there could have been solutions. Various infectious disease specialists saying there could have been ways to get around this. So what's happening here with basically really a lack in trust in adults to follow rules if you were to put them in? I'm just trying to get an idea of why not pursue, in your opinion, some creativity about trying to get this done safely?
So, Lucas, I think you ask, a very good question, and I'm sure I should say that many people are certainly interested in Halloween. And as I mentioned in my remarks, many of us do look forward each year to Halloween festivities. And it's my sincere hope that people will continue to exercise creativity, as you spoke of, as they approach their Halloweens. I think the issue is that, as I mentioned in the remarks, the challenge is that, trick-or-treating, yes, is often outdoors, but it's not always outdoors, depending on what your living arrangements and circumstances are. And we know also that it's a situation that, frankly, just brings lots of people together into close contact. So it's way too possible for people to mix closely, to let their guard down. And we know, now that we've lived with this virus for several months, that these are exactly the kinds of circumstances that give rise to COVID-19 transmission. So given what we know about our current resurgence of COVID-19 activity, given what we know about how the virus spreads, and given what we understand of how Halloween festivities are generally observed and enjoyed by the people of Toronto and many other places, You know, it does seem to me that this is a reasonable approach, as disappointing as it might be. And as the mayor suggested, you know, with respect to some other holidays, perhaps we can find another time to celebrate an extra Halloween at some point in the future when this is all behind us. But I'll let the mayor comment on that, whether we can declare an alternative Halloween at some point in the future.
Right. I just want to get a better understanding, though, Doctor, about why the decision in your mind not to even explore the idea of, if you put in certain rules and regulations ahead of time, why not, you know, trust the public to follow them? So if you could just wrap that in a bow. And also, Chief Pegg, actually, since these are now being recommended, what happens if there are some either rogue Halloween parties or even some patrolling of the day of? Is there going to be some sort of, you know, kind of patrolling or bylaw, you know, action presence the day of Halloween?
So let me start off, and then I'll hand it over to Chief Pegg. So first and foremost, given the activity that we're seeing here in our community, the advice has been to limit the contact that you have with people that you don't live with to the greatest extent possible. And I think that when we look at what's happening here and what we know about virus spread, this notion of actually exploring or having an alternative Halloween and taking this particular recommended approach as delivered by the Chief Medical Officer of Health, given our current circumstances, this is the most consistent approach. If we're meant to limit our interactions with others with whom we don't, you know, people that we don't live with, then this makes the most sense to my mind in terms of a consistency of messaging, which I think is really important and reflects the situation as we see it on the ground, and as well reflects our understanding of how COVID-19 is transmitted from person to person.
And Lucas, from an enforcement perspective, I think first and foremost I would say that we have every confidence and every belief that the overwhelming majority, if not all of Torontonians, will comply with the advice that's being given, as difficult as that may be. Enforcement continues as it does every day. Anyone that observes gatherings or other behavior that constitutes a concern should bring that to our attention through 311, and our enforcement teams will respond and take the appropriate action based on the investigation at the time.
Okay, thank you. We go next to Mark McAllister from City News. Mark, go ahead.
Thank you, Dr. Davila. If you could address some of the things that did come from the Board of Health meeting this morning, namely the equity action plan that you spoke of to help groups disproportionately affected by COVID. Some of the recommendations that came forward, I'm curious at this point, some of these things, are they not already being done? And if so, why haven't they been effective to this point? And if they're not being done, why not when we knew about the problems in these neighborhoods 4 or 5 months ago?
So, Mark, I think there are a number of actions that have been taken, not only by Toronto Public Health, but other city divisions and indeed other community agencies throughout the city in terms of trying to mitigate the negative impacts and the impacts particularly on those neighborhoods and individuals and communities that are suffering disproportionately as a result of COVID-19. There is much more that needs to be done, and I think it's really important that we note that some of the challenges that have been highlighted or really laid bare by COVID-19 actually pre-existed. They were there before COVID-19. They have just become exacerbated and more pronounced as a result of COVID-19. So these are issues that will take some time to resolve, but I think it's important that, and actually I think very commendable really of the Board of Health to focus efforts on a health equity action plan. And certainly we at Toronto Public Health are very keen to move forward with that health equity action plan to address the issues that need to be addressed, because in fact they're quite consistent with that which we do in public health. We are always about focusing on improving the health status of the population and doing so in a manner that actually reduces inequities in health status. Whether we're talking about COVID-19 or any other health issue or any other social determinant of health, This is exactly the focus of public health, so we're happy to be focusing on these kinds of, the kinds of activities that are being called for under the Health Equity Action Plan. And we'll look forward to working with city divisions and other community partners on that important work.
The modeling you had shared when the stage 2 was introduced with regard to when to bring in intervention and what that might do to case counts at different points in how to go about reducing the infection rate. What was presented this morning, was that an updated model, and does it mean that as a result of the modified stage 2, you're looking at that being enough and that in fact that infection rate will be going down?
So the modeling that was presented today at the Board of Health was indeed updated relative to what I presented at a press briefing now some time ago. And in particular, it reflected the new reproductive number that we're currently experiencing here in Toronto. But at the end of the day, the main message remains the same, that the earlier the interventions are put into place, interventions that we know make a difference to virus spread, that reduce COVID-19 transmission, the better off we are in terms of reducing the overall burden of infection rates. And in fact, when the data were presented this morning at the Board of Health, we talked about, the introduction of interventions in early mid-October versus a date that was towards the end of the year. And the differential in respect of overall infection counts was as much as like 3 times less with earliest introduction of public health measures relative to waiting until an introduction of interventions later in the year. December, I believe, was the date we were looking at.
Okay, thank you. We'll go next to Sabrina Jonas from the CBC. Sabrina?
Hi, good afternoon. Thanks for taking my question. Dr. Davila, I know you touched on this a bit in regard to the new neighborhood data, but why is it alarming to see that the percent positive rate in the rustic neighborhood is over 14%? And what do you need from the province to combat this?
So I think that's a very important point to look at. And I think, again, we do not want to look at percent positivity data in isolation. It really does need to be looked at in concert with other information to provide much needed context. So in particular, we talk about case counts and case rates and testing rates. So what was interesting about the data that were presented in respect of that one particular neighborhood, Rustic, and it was data that were presented for a period of time in late September, and it may have changed by now. So we have to look at trends over time. But looking in particular at the testing rates that were that affected that particular neighborhood at the time that we're looking at that percent positivity rate. In fact, what we concluded was that more testing is probably needed in that neighborhood to fully understand what's happening. So you may have a falsely inflated percent positivity rate when you actually look at a neighborhood if in fact it's a relatively low number of tests that have been done in that particular neighborhood that gave rise to that percent positivity rate. So there are a number of different circumstances that need to be looked at. I would strongly encourage people to look at our data in totality. There are lots of notes available on our website that explain these important findings, and we're going to continue to put out information with context so that people can understand what actually is happening as best as possible in the various neighborhoods around the city, and so that we're informing ourselves and informing our provincial partners and others around what might make the most sense in terms of what's happening in particular neighborhoods.
A follow-up, Sabrina?
Yes, thank you. Thanks for that response, Dr. Davila. Mayor Tory, could you weigh in on the calls to the province for help and what advocacy you're doing for targeted neighborhood testing in Toronto?
Well, I have taken again the advice, because I'm not an expert on testing and I know it's a provincial responsibility. So when Dr. Davila has made suggestions, or the Board of Health or others of my colleagues, as we've sat and discussed some of the testing needs, I've advocated for those to the province, and have been, certainly I think the medical officer, our medical officer would tell you that any time that there's been any city resources, city locations, or anything needed, I've offered that to the province, and I've offered it to her so that everybody's very clear we will do whatever we can to make sure that those neighborhoods are given the extra support that they need in respect of increased testing.
Okay, thank you. We will go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Dr. Davila, in the presentation this morning on percent positivity, it was declared that taking the information, the percent positivity alone risks stigmatizing certain areas. And yet, when it reaches a certain level, I think it's 5%, I think it was Sarah Collier said that those areas would be grayed out for privacy reasons. I'm just wondering how you sort of square the two, where you're not including all the information as it becomes available, and if that itself, that 5%, where people would just automatically assume that it's at a certain level, if that itself does not stigmatize that neighborhood by doing so.
So, Matt, I think you ask a very interesting question, and I'm not sure the interpretation is quite right. So when it comes to presenting data, particularly when we're presenting data by neighborhood in those local small level areas, we have to be very careful that what we are putting out there does not in any way, shape, or form violate privacy or run the risk of violating privacy. So when the numbers are relatively low, and we are talking about numbers that are being reported at that neighborhood level, we know that the risk is very high. So that's when we suppress those data. And oftentimes what we'll do to get around that, in order to provide information to the public so that they can understand for themselves what's happening, is that we can bundle up data over weeks at a time so that the numbers aren't so low and you don't end up with quite as much risk of violating privacy inadvertently or otherwise. So that's what was presented today. When we don't have enough data to actually appropriately protect privacy, particularly when we're talking about small level, small area analysis, we have to be very, very careful. This is a standard practice in the reporting of epidemiologic data, and it is done with good reason. So, but we find ways to make sure that our public is aware of what's happening wherever possible. And you can count on us to do that, as that's exactly what we have done in many other circumstances. When the numbers are simply too small, we stack them up, if you will, over time so that we're dealing with larger numbers and the privacy risk is reduced, but we're at the same time still providing information.
Thank you. My next question is for, I guess, Chief Pegg, because I'm not sure if Chief Raymer is on the line, but in regards to these mass protests we're seeing about anti-lockdown, anti-masking in the downtown, there seems to be very little police enforcement, and I'm just wondering why there seems to be a lack of ticketing when it comes to that, outside of some of the organizers or speakers, where there have been people ticketed for having parties or for being in parks and violating those rules, and what kind of message it sends to those people who are following the rules.
So, Matt, I'll start, and then I believe that we have Deputy Chief Demkew on the line as well. I think we can all appreciate, Matt, that these protests and related gatherings are very challenging and dynamic situations. And as we all know, our police and other enforcement agencies and partners are always involved and are always present in those situations. But our police officers are confronted with a situation where they are provided with the difficult task of trying to find an appropriate balance between protecting the public health issues relating to gathering and masking or lack thereof, but at the same time balancing that with a very dynamic situation and taking every precaution to ensure that situation does not escalate and become a public safety or public order concern. So they are difficult, challenging situations. They're very dynamic. No two situation or no two protest, if you will, is ever the same. And it relies and frankly demands I would say the independence of investigation, so at a case in point circumstance, and considers that or requires that balanced and considered response on the part of police. So, Brad, I believe we have Deputy Dempsey online.
Yeah, Deputy Chief, can you add to that, please?
Yes, thank you so much. Again, Chief Pegg summarized our challenges quite succinctly. And I think what's important is, when policing large crowds, our officers are certainly trained to maintain public safety and public order. And there's an element of discretion that has to be utilized given the circumstances they're facing. And each case is unique, and each case requires specific considerations given the context of what they're facing. And they have to take into account wider public concerns and safety concerns as it relates to crowd management and the circumstances they face. So when it comes to events this weekend, our officers did their task of maintaining public safety while allowing people to exercise their democratic right.
All right, thank you, Deputy Chief. We'll go next to Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi. Good afternoon, everyone. My question is for Dr. Davila. Dr. Davila, you mentioned that consistent messaging is important and that recommending against trick-or-treating is consistent with the current precautions that people are being asked to take. But I think some people are looking at trick-or-treating and saying it's outdoors, it can be done while wearing a mask, in groups of people belonging to one household, and the candy can be distributed, doesn't have to be distributed, hand to hand. I mean, isn't it consistent to allow trick-or-treating? I mean, it seems to tick off all those boxes.
So Francine, I think that you're quite right. Trick-or-treating is often outdoors, but it's not always outdoors. Not everybody has that circumstance in their daily lives. So there's certainly that risk. And I think, as I mentioned earlier, the challenge is that Halloween is one of those festivities or celebrations that just gives rise to the risk where we bring too many people together into close contact, and one where it's possible for people to just mix too closely, get into close contact with each other. So physical distancing isn't maintained as a result, and sometimes the guard gets let down because you're with people that you know, and then masking goes away. And what you've got then are circumstances that are ripe for COVID-19 transmission. So the advice right now for jurisdictions like ourselves, like Toronto and Peel and Ottawa and now York, is that we are meant to limit our interactions with others with whom we don't live. That's what we're being advised to do, knowing what we know about virus transmission. And as painful and, as difficult as it is to deliver this kind of bad news, especially in respect of a celebration or an event that so many people in our communities enjoy, I do believe, and others do generally believe as well, that there is good reason to continue with or to support the advice that has been provided by the Chief Medical Officer of Health to, focus on different ways to celebrate Halloween this year. To focus our efforts on bringing COVID-19 transmission in our community down so that we can do important things like protect those of our community who live in long-term care, those in our community who are older, and as well, we want to continue to maintain the safe operation of our schools. And we know that the most important factor in continuing the safe operation of our schools, or as safe as possible in the era of COVID-19, is reducing community transmission rates of COVID-19.
And a follow-up question. Does public health have to worry that public trust could be eroded by recommendations that are difficult to follow and that are perceived as not being strictly necessary? And how does this, play a role in the recommendations that you make?
So Francine, I think public trust is always of concern to those of us who work in the public sector, and for whom the public trust is fundamental as we seek to carry out our objectives and discharge our obligations to the public. And that's why I think that it is, important, and I made note of this, that there is a great deal of unity, I would say, around the Greater Toronto Area and at the provincial level in respect of this advice. It is consistent with that which has been offered as good advice to limit the spread of COVID-19 in communities like Toronto, Peel, Ottawa, and York. And, my sincere hope is that there is understanding as to why it is this is the recommendation that has been offered on the part of the Chief Medical Officer of Health for these communities that are now in a modified stage 2, given their unique circumstances and given high rates of COVID-19 transmission in our communities. There's nothing we would like more than to bring those rates down, because we know that that's what's safest and what's best for all of our communities. This is not just about Toronto, but frankly, it's about communities all around the province.
All right, thank you. We go next to Jennifer Pagliaro from the Toronto Star. Jennifer, go ahead, please.
Hey, good afternoon, everyone. For Dr. Davila, your team and you discussed here the testing. I know you were asked about that earlier. I know that there were pushes to have mobile testing in that northwest part of the city, and that did happen, but I'm unclear as to whether that was sustained or if there are any new efforts. So I'm wondering if you can tell us what happened to mobile testing. I know it's the province's responsibility, but hoping you can shed some light on that.
Yeah, so you're absolutely quite right that the testing is within the provincial purview. It is a clinical or healthcare service, and so our healthcare partners are the lead on issues like COVID-19 testing. That being said, we are in regular communication with them. We have had successful endeavors with a variety of healthcare partners, some more locally based in the community, others that are perhaps more regionally based here in the city of Toronto, to undertake better and more mobile pop-up testing efforts, if you will, in parts of the city that are most affected by COVID-19. So that has happened and will continue to happen, premised on conversations that we are still having and will continue to have with our healthcare partners, whether they're the local community agencies or those that are provincial agencies that are responsible for the delivery and planning of healthcare.
And I just wanted to follow up on what you answered earlier about testing rates in conjunction with understanding the percent positivity. So in an area like the Northwest, we see a high percent positivity and also low testing rates. And so can you explain a bit further what you mean about the need for more testing, that it doesn't necessarily mean that with more testing, we'll continue to see a sustained percent positivity, higher than 10%?
So, very briefly, I guess the simplest way to look at it is that you may look and see a figure that suggests a relatively high percent positivity when it comes to COVID-19. But if in fact that is premised on a low number of tests, you may not be getting a real sense as to what's happening in the community. Hence, when we look at data around percent positivity, what we recommend is that you look at it in the context of a wide variety of other indicators to help really inform what does that particular indicator mean. So we look at case counts, we look at case rates. We absolutely are now able to look at percent positivity thanks to our provincial partners who are sharing those data with us, and as well testing rate data so that we can understand, is this a true circumstance in which we're seeing some degree or a higher degree of virus spread that's changing over time? Or is this a reflection, is this particular indicator at this point in time a reflection of a relatively small number of tests, such that a relatively small number of positive tests actually reflects and manifests as a high percent positivity? It's just a question of numbers. So what you want to know is, do you have high percent positivity and at a level of testing that really tells you that this is a more reliable figure to look at?
Okay, thank you. Final question is to Kelly Grant from the Globe and Mail. Go ahead, Kelly.
Hi, thanks for taking my question. This is for either Chief Pegg or Mayor Tory. Just to be clear, does Toronto intend to fine and ticket people who trick or treat on October 31st?
Hi, Kelly. It's Chief Pegg. I'll start. So as I explained before, our enforcement activity and our enforcement teams are active every day and night of the year, and that will certainly be the case on Halloween. And like we've talked about before, and I think it's really important to emphasize, there is no blanket answer, nor will there ever be any, I would say, direction related to enforcement activity. We respond to complaints relating to things like gatherings and other issues. They're investigated by the enforcement officers, and those enforcement officers, and rightfully so, exercise their independence of authority in investigating and in making the decision as to what the outcomes are. So we will respond, we will investigate, and the officers, including police and municipal licensing and standards enforcement officers, will take the action that they deem to be correct in the circumstances. Mayor Tory?
I'll just say for myself that I hope not. What you hope with a lot of these policies, where we've admitted up front that there is not a feasible way in which you could go around enforcing the law, and I don't direct that in any event, and I think Chief Pegg well explained how that actually happens with respect to the discretion exercised by different law enforcement officers. But I hope people will understand that this was based, first of all, on expert provincial advice, and that secondly, for all those involved in accepting the advice, in offering advice that led to the advice, this is a painful, agonizing, difficult thing in a series of painful, agonizing, and difficult things, because we know kids and families are not going to be happy about this. But in the end, we have the experts that are giving us advice because they're experts, and we have to trust them, and we have. And I think we will continue to trust them, because that's the best hope we have of getting out of this mess. And we've seen some of the price to be paid elsewhere when people ignore the advice of the experts.
If I could ask a follow-up to that, if we want to talk about advice from experts, Bonnie Henry in BC, Dina Hinshaw in Alberta, Teresa Tam, the Chief Public Health Officer, and the public health and political officials in Quebec, where the COVID situation is demonstrably worse than it is here in Ontario, have all said that trick-or-treating with some care can in fact go ahead. So why are they giving and receiving different expert advice than the advice you are getting and giving?
So, I think first and foremost, I do respect our colleagues all around the country. They are all doing their very best in my discussions with them to manage the circumstances that they have in front of them. And I think we're doing exactly the same thing here. I know that my colleagues at the Province of Ontario and the Chief Medical Officer of Health has considered very carefully the advice that he received from people around the province here. There are experts offering advice at a number of different tables at the province. I know particularly of the public health measures table, and there are discussions that are constantly happening around what makes the most sense for our circumstances at this time. And fundamentally what this comes down to is that there are opportunities. While yes, it is true for many, trick-or-treating may very well happen outside, it is not that case for everybody. And in fact, we also know that it is a situation. Halloween festivities are the kinds of situations that bring people together, many people together, often in close contact, and give rise to those circumstances where people tend to let their guard down. And I can tell you that here in the City of Toronto, what we have observed since August the 1st is that, those kinds of circumstances within which people get together in close contact, not physically distancing, not wearing masks, letting their guard down. These are the kinds of circumstances that give rise to COVID-19 and COVID-19 transmission. And we are seeing this reflected in outbreaks and clusters here in our community, notably in long-term care, which we really do want to protect given the vulnerability of the residents in that setting. And as well, we're concerned about what impact it may have on schools. So it is a difficult decision. I think the mayor has put it quite nicely, that it is an agonizing and very, very difficult decision, and one that is, truly challenging to make, because nobody wants to rain on the parade of families and children all over. But it is one that is meant to protect the community as best as possible from the negative impact of COVID-19.
Okay, thank you. Just a reminder, Kelly, I just want to be clear that this is advice, not to trick or treat. There is no law, so therefore there wouldn't be anything for Chief Pegg or TPS to enforce. Thank you, everybody, for joining us today. That concludes today's briefing.